welcome to the Vernon Jubilee Hospital's version of the pre-op preparation rehab session for total hip replacement patients. The outline for today's session will be to talk about the surgery in simple terms, a little bit about the hospital stay, where to go and what to bring with you. The rehab, sort of what to expect after your surgery, both at the hospital and following your return home, the first couple of days to 2 to 3 weeks of recovery, and a review of the equipment items that will be helpful to help you convalesce in the early days and weeks after surgery. This discussion helps sort of frame the equipment items and which ones are available from the Red Cross and sort of how that Red Cross process or equipment loan process works for patients having this upcoming surgery. There are quite a few different sessions and phone calls leading up to surgery. And so I thank you for watching this one. In addition to the others, we have found over the years that people who are more prepared for surgery have a better understanding of their responsibilities, things that they should be preparing and getting ready for before the surgery. This leads to a better hospital experience, less anxiety about coming to the hospital or while at the hospital about what will happen next, what information you'll need to know about being released from hospital and getting home. And these patients with more information and a better understanding do have a faster, easier recovery and fewer complications and fewer return visits to the hospital after leaving. In terms of COVID considerations, at this point, things have been fairly stable in terms of changes around the hospital visit for some time now. I think the things that we know are that patients will have only a few access points to enter the hospital. One would be coming in through the main entrance of the Polson Tower. So that will be the second sort of driveway entrance into the hospital grounds. That entrance will take you right in onto the second floor, where there will be a greeter to do some screening to make sure that you've got some directions on where to go and how to get there. There are probably a few of you who might be coming extra early in the morning on the day of surgery, and you might be directed instead to come in through the emergency entrance, which would be that first driveway left into the hospital and then over to the right to the emergency entrance. Everybody is required to wear a mask most of the time while they're in the hospital, certainly in the hallways and public areas. All visitors are also required to wear a mask, and visitors coming for social reasons after your surgery probably will be allowed to come. They just need to show some proof of vaccination and identification at the door. There is no longer any COVID screening at the door or, to enter the hospital. But if you have had, there isn't COVID testing, I don't believe. But there will be some questions answered. And if you've had COVID recently, they are finding now that 7 weeks of recovery for your body is quite important to give you the best chance of a good recovery after surgery. So they are trying not to do surgery within 7 weeks of having actual COVID. In Vernon, so there are different ways of doing hip replacements. Some surgeons approach from the front, some from the side. In Vernon, our surgeons are doing the direct superior approach, which means that their incision is kind of on the upper outer rear aspect of the hip. So it is sort of about a 3 or 4 inch horizontal or diagonal incision across, roughly in the area at the top of your outer jeans back pocket. So you'll be positioned in the correct way in the operating room. There will be a 3 or 4 inch incision made through the skin. For the most part, the surgeon can avoid cutting a lot of that muscle tissue, just sort of moving and stretching the muscles off to the side. And then that kind of gives them a bit of a view down into the actual hip joint itself. They do need to dislocate the hip and sort of pull the ball out from the socket. They do sort of pull that out and hold it out there by traction, and then get into a fairly small space with quite maneuverable surgical tools and technique. Scrape out the socket side and prepare the area, put in a new cup with a nice smooth liner. Then they'll kind of go back in, cut through the upper leg bone to take off that arthritic, kind of rusty, rumbly ball. Take that out of there, prepare the leg bone a little bit, and put a new stem down the leg bone with a nice smooth round ball at the top. So once they've got the leg stem with the ball in and the new socket cup in, they remove the traction so the ball and socket come back together where they will glide nicely. They'll pull the muscles and sort of put them back into place and put staples in the skin. So the whole surgery, that is, in very simple terms, but the whole surgery takes about an hour, give or take 15 minutes or so. It's usually being done under general anesthetic, but you'll discuss this more with your anesthesiologist. So from the operating room, you'll go to the recovery room and then possibly to a day surgery area of the hospital, or possibly from recovery up to the surgical floor. There are a certain percentage of patients that go home from the Vernon Hospital after this DSA style hip replacement on the same day as their surgery. That would usually be patients having their surgery done earlier in the morning that might be ready, mobility-wise, pain-wise, and having a good support system at home, ready to leave hospital by around 3 or 4 in the afternoon that same day. That seems to be maybe about 30 to 50% of our hip replacement patients. And then a certain number of people will be in the hospital overnight and being discharged the following morning, somewhere between 9 and 10 in the morning. So quite an early in the day discharge. Whether you're released from hospital the same day or the next day, you'll be leaving hospital with the same types of information. A few things that I like to mention in terms of timing, I guess. Your first follow-up with the surgeon is generally at about 2 weeks post-op, and that appointment will be, you'll see the surgeon in the hospital in ortho clinic. So when you go home from hospital, one of the pieces of paper you'll have is a form that has the surgeon's office number circled, a date, and you'll need to phone their office to book your staple removal. So you book it through their office, but you'll see them in the hospital at about 2 weeks post-op. The next time you'll see the surgeon is at about 6 weeks post-op, and that one is in their office. For people who live far, far away from Vernon that aren't sure if they should be traveling back for, at the 2 week mark, I would say call your surgeon's office directly to clarify what they would prefer in your specific case. Sometimes arrangements can be made to have your staples taken out and a bit of a check-in with a surgeon or family doctor closer to home for that 2 week appointment. Until the staples come out, there will be a bandage over top. That bandage is, roughly a 4 inch by 4 inch square, seals all the way around. So it's got quite a nice seal on it. What your job is to keep that area clean and dry, keep the bandage on and sealed all the way around while the staples are in. You'll be sent home. You'll be sent home with a spare bandage. and instructions from your nurse on when to change the bandage. There won't be a home care nurse or anybody booking to come and see you. You'll be responsible to change your own bandage, but essentially you just sort of peel the old one off and put a new one on. There's no fancy wound care to be done. We would really prefer you not touch it with your hands or wipe at it with Q-tips or anything like that. Just keep it clean and dry. The bandage is water resistant, so you'll probably be told that you can have a shower within 3 or 4 days of getting home from hospital, but just maybe keep the water directed sort of away from that area if you can. Try not to soak the bandage enough that it could be at risk of coming off. Medication instructions for going home, sort of two categories that we like to mention. One is pain medication. Most people do leave the hospital taking some kind of pain medication, whether it's Tylenol, plain, or something stronger prescribed. Regardless of what your pain levels are requiring for medication, we do ask that everybody take their pain medication on a regular schedule for the first 3 or 4 days that you're out of hospital, rather than sort of trying to grit your teeth and get through without taking pain medication. Please manage your pain well, stay ahead of the pain. Don't let it spike to levels that make it difficult for you to do your exercises and to get up and walk and move around. That's really important. After the first 3 or 4 days, you can probably taper back the medication a little bit and take the pain medication as needed. The other medication is a blood thinner. Everybody will be on some kind of a blood thinner regimen after surgery. And again, those are different medications for different people. That's going to be prescribed by your surgeon or another physician. What you should know is that it's really important to take your blood thinners at the same time every day for the length of time that it's prescribed. So that is going to be your best chance of reducing the risk of blood clots post-op. Things to bring to the hospital. You won't be here for a really long time. You might only be here for a few hours, or you might be here for one night. So generally speaking, bring a toothbrush, bring a few basic toiletries. Even if you have a very firm plan for going home the same day, if the medical factors like your blood pressure or your nausea or something don't support that, you won't be discharged unless you're well enough to be discharged. So bring a toothbrush, bring your hearing aids, bring whatever sleeping gear you might need, CPAP machine, things like that, just in case. Equipment wise, we do request everybody bring in crutches with them when they arrive for surgery. So if you are borrowing crutches from a friend, or you've got a set in your basement, or if you're borrowing them from a loan equipment program, our physio at the hospital wants to see those crutches to make sure that they've got good rubber tips, good padding, and that they're adjusted correctly for your height. And they will do an assessment, sort of teach you how to walk on the stairs and things like that with crutches. There are some people that prefer or are a bit safer to use a walker after surgery. And we'll talk a bit more about equipment in a few minutes. Do not bring a walker into the hospital unless you need it to get in the door. We would be able to set up a walker for you to use while you're here, you could have your walker from your Red Cross or something could be waiting for you at home or in the car that comes to pick you up. If you wear clean clothes and have a shower on the day of surgery, you could probably wear those clothes home again after surgery. So do think about wearing loose, comfy clothes when you arrive. Nice loose sweatpants, loose, soft waistbands, not jeans or anything with kind of a rough or tight waistband that might pinch at your new incision area. Pajama pants are nice to have. While you're here at the hospital, you'll probably be wearing a hospital gown, but pajama pants or shorts might be a nice addition, a bit more comfortable, and maybe a light robe or a cardigan, sweater, or something like that, just a little bit more coverage after surgery. We would like you to have good, sturdy footwear while you're here, so we do prefer runners or walking shoes over loose, sloppy slippers. So we definitely would like something that has got a heel or a strap on the back, and it's going to stay well fastened to your foot. We will help you with your laces, or you could get elastic shoelaces, but we just don't want any risks of shoes kind of sliding off your foot while you're up and walking after surgery. If you bring a cell phone or tablet or anything with chargers, please put your name on everything. Put your name on the charger, put your name with a piece of tape on the devices, put your name on your toiletries bag. Kind of, if you could label everything with your name, just makes it a bit easier to get things back to you if anything is left behind. So while you're here, what you can expect is that after surgery, you'll be up and moving quite quickly. So probably within an hour for most people. You'll be up and moving, sitting on the edge of the bed, sitting in a chair beside the bed, getting something to eat, standing, putting some weight on your leg, walking, going to the bathroom, all of those things. So there's not much laying around after surgery. We can get you up and going pretty quick. Therefore, it is quite essential that you do that pain management approach. Take your pain medication in a way that helps you stay ahead of the pain and avoid those breakthrough pain crises. If your nurse offers you pain medication and you don't feel like you have pain at the moment, maybe ask them when your current dose is due to wear off. They may be offering this next dose, 15 or 20 minutes ahead of that in order to give it some time to take effect. While you're here, the physio was going to be coming to see you at some point, and they are usually kind of running from bed to bed. So we'd like you to feel ready and prepared when they get to you, that your pain is well managed and you can get up and do some moving around. It's probably going to be your nurse that's the first one to get you up and moving, but the physio will be coming to see you for a deeper, more thorough assessment after lunch, or for some of you, maybe the next morning. Just depends what time of day your surgery is and where they are in their work list for the day. When the physio sees you, they are going to be looking very carefully at how well you can move your legs to get in and out of bed, how you look when you're walking, the quality of your walking style, what type of walking aid or gait aid is going to be best for you. Maybe that is a walker for a bit more safety and stability. Maybe it's crutches, maybe it's one crutch. So that's what the physio's assessment is going to help them give you those recommendations. They will practice on the stairs, make sure you know that technique if you've got stairs at home. The physio will also go through your home exercises with you, teach you what that exercise program looks like, how to do them, how many to do, and they'll send you home with a pamphlet that has the exercises outlined, how often you should be doing them, how many of each you should do. And they will also be putting in a referral to the outpatient physio for follow-up after you've left the hospital. So those referrals sometimes go to the local hospital outpatient physio department, or they could go to a private physio if that's your preference, and if you've got some medical benefit coverage to help pay for that. So if you're going to go the route of private physio, what we'd ask is that you can choose your physio, that's fine. Just bring their contact information in, maybe a fax number, so that the hospital physio can forward any surgical orders or information that that home physio might need. When you get up and stand and walk for the first time after surgery, the surgeon will have made a note in your chart about how much weight you're allowed to put on the operated leg right off the get-go. And usually this weight-bearing notation says weight bearing as tolerated. So that means that the components and the bones are able to take full body weight right away. The as tolerated refers more to the fact that the soft tissues, the muscles, and the other soft tissues around that area have just been stretched and cut into a little bit. They're feeling probably quite inflamed, sore, bruised, and they're probably not feeling quite ready to take full weight in this exact moment. Those soft tissues recover very quickly, and so your your walking, your gait pattern improves dramatically in the first few days. But that first time that you get up, you'll be sort of taught and reviewed on the proper technique for moving in bed, sitting to standing, using your walker or your crutches, doing the stairs. We're really looking closely at having people moving safely, but also moving symmetrically, trying to offload those muscles just enough that they are still doing the maximum amount of work that they can do, but that you're not limping and sort of having this heavy, awkward gait pattern. So your physio is going to be talking to you about how to progress your walking. So what distances you're walking, what type of walking, whether you use a walker, 2 crutches, 1 crutch, a cane. They'll give you the guidelines on how to recognize when it's time to progress yourself. This bruising and swelling, pretty common for most people to have some amount of bruising and swelling. It can be quite different from person to person, and that's okay. I think for pretty much everybody, that first week or two, there is quite a priority put on getting the swelling down. The sooner the swelling comes down in your hip, but also swelling that can sort of flow down your leg and leave you with a fat foot and a stiff knee and a tight calf. The sooner all of that swelling can get out of your leg, the better all the muscles of your leg are going to be able to work together to help you walk really well. So first week, while the swelling is still quite soft, we would like it to move along, move out of your leg and out of your hip. And to do this, we ask that you don't sit in a chair with your legs down, at the kitchen table or something, playing cards or eating for longer than a half an hour. That just means get up, move around, keep the muscles kind of squeezing and working away at that fluid. Also, lots of ice around the hip, sort of front, back, and side, or a cryo cuff if you've got access to one. Could rent one, purchase or borrow one. A cryo cuff is sort of an ice machine that circulates icy cold water around through a neoprene cuff that you could place around your hip. Or you could use vegetable packs or gel ice packs. I would say have a few of those handy in your freezer so that you can be rotating them. Not directly on your skin. Make sure you've got a towel or something between the ice and your skin, but about 15 or 20 minutes of every hour or two, just depending on what your body needs. That much icing in the first few days can make a big difference. And really important is to elevate the operated leg for a good 30 to 45 minutes, 3 or 4 times a day for that first week. We would like to see your legs elevated higher than your heart 3 or 4 times a day for 30 to 45 minutes. A good way to set this up would be when you do your exercises in the bed 3 or 4 times a day or as directed, just plan your time so that you can stay there when the exercises are finished with your legs elevated on a stack of 3 or 4 pillows. In this position, you could be putting the ice packs on, you can be doing some ankle pumping to help squeeze that fluid, and gravity will help move it up and out of your legs so that your heart can kind of pump and carry it away to other parts of the body. Crutches are sometimes something that people feel a little anxious about if they haven't used crutches before or they haven't had good luck using crutches before. I would say please keep an open mind to using crutches and at least bringing them in to the hospital and letting the physio do some assessment. You might find that you do better with them than you expected because you're going to be putting weight on the operated leg, quite a bit of weight. Probably by the time you leave the hospital, you're already going to be feeling quite comfortable to put about at least half your body weight through the operated leg. So your balance is quite good. You're not hopping along on the crutches the way you would with a broken ankle. You'll be walking on your own 2 legs, using the crutches for support to offload some of the weight for those muscles while they're initially recovering. So bring them in, give them a try, and the physio will have a pretty good conversation with you about how that goes. I'm going to play this video I don't know if the sound is going to work, so I might talk over it a little bit just to sort of show when they're sizing the crutches. And the rolled up pant leg is the operated leg. 2 or 3 fingers between your armpit and the crutches. And the handle at your wrist crease. Crutches, surgical leg, non-surgical leg. Okay. If crutches don't seem to be the right thing for you, another option is a 2-wheeled walker. This is quite important. We prefer the 2-wheeled walkers to the no-wheeled walkers, finding that the standard walker or the one with no wheels can slow people down. You'll probably be able to walk better than that. And so the 2-wheeled walker is just a little less work. You don't have to pick it up and move it with every step, but you can still load weight through it, and it's designed to offload your weight. The problem with a 4-wheeled walker, why we do not want people to use a 4-wheeled walker immediately after surgery, is number one, they're on 4 wheels, and so there is the risk that they could roll away or get going too fast for you. The other thing is you have to follow along behind them, so you'll be kind of bent forward, and it doesn't really allow you to use all of the muscles on the back side of your hip very well. You're not going to be standing nice up and tall and having all of the muscles around the whole hips and sort of glute muscles all working together. So we would like you to have that frame style walker if you need a walker, so that you can get right in between the handles, stand up nice and tall, just the same way you would with crutches. Stairs. Stairs are difficult to demonstrate over Zoom, so I haven't been trying that. I can play this video. This gentleman goes up and down the stairs fairly quickly, but again, it's kind of demonstrating that you'll be putting weight through both legs using the crutch for balance and the handrail, and the physio will be reviewing that sort of technique of going up the stairs with the non-operated leg going up first and then coming to meet with the operated leg and crutch. And going down the stairs, you would be leading with the crutch and the operated leg, and then coming down to meet it with the non-operated. That's easier to learn in person than to describe, so I'll show you the video, but rest assured, this will be practiced in the hospital. So the physiotherapy after surgery, like outside of the hospital, that referral will be made by your in-hospital physio. They'll be sending a referral to the Salmon Arm Hospital or Nelson, wherever you're from, or Vernon. And so those referrals will be received on the other end, and you should be getting a phone call to schedule your first appointment. So if you have been home from the hospital after surgery for 2 weeks and you haven't heard, please don't wait any longer than that. Phone your local department and give your name and your surgery day and get booked in. Generally speaking, at around the 2-week mark, when your staples come out, you'll have outgrown those early hip exercises. You'll be ready to be reassessed in clinic and upgraded on your exercise program. The hip replacement done with a direct superior approach heals quite well. And fairly quickly. The muscles recover from their swelling and their stretching and bruising. They're not really cut into. There isn't a lot of soft tissue trauma to be healing from, and so people bounce back fairly quickly. We have been finding usually about 3 or 4 physio visits spaced about 2 weeks apart is sufficient for these types of hip replacements. You'll be upgraded, sort of progressed along at that pace, and at the 6 or 8 week mark, your physio will probably be ready to discharge you from that really monitored physio approach, but they will be talking to you about a transition plan. You'll still need to continue doing home exercises and maybe gym or pool exercises, walking on a schedule, sort of with that progressively walking farther, adding difficulty for the terrain, more slopes, things like that. And you're going to be working at improving and developing strength and endurance for at least 3, but probably more like 6 to 12 months. So you only need to be really kind of protected by the physio with this really guided approach for about 2 months, but you'll still need to maintain your efforts and keep motivated to keep working at your rehab, strengthening and endurance. You'll be doing your own physio by doing your exercises and by walking, and your physio is the coach. They're coaching you along at the beginning, but then you'll continue on your own. Patients' tips for the fastest recovery after surgery, fastest, smoothest recovery, are definitely, without question, do your exercises, do all of them. If you find something difficult or awkward, talk to your physio about it. They can probably fine tune that or give you a different exercise that targets the same muscle that feels a bit easier to do. Elevate and get that swelling down. Elevate and ice, I should say. Get the swelling down in the first week or 2. That makes a big difference in your recovery. And when you're walking, don't limp. So use a cane, use a crutch, use walking poles, or whatever you need to do so that you can walk and progressively walk farther distances without fatiguing and starting that sort of bad limping pattern again. So there are a few notes here about the risks of surgery. Sure, there are risks. I'm sure your surgeons talk to you about them, and the nurses have talked about these. But do pay attention, for the signs and symptoms of infection, the signs and symptoms of blood clots. Know what those things are so that you just kind of keeping half a mind, and you can get in for early treatment or early assessment if you think you might be having something going sideways. So heat or redness or drainage at your incision, developing a fever, that could be a sign of infection. Some people don't think of a fever as relating to their hip, but it could. If you have a sudden change in the swelling in your leg, or some other place, or if you develop shortness of breath or sort of funny chest, heart feelings, even if it's a bit subtle, I would say go and get checked out by a medical professional to rule out any blood clot type things and start treatment if it's needed. These things are easier to treat the earlier they're caught. And worst case, you're told you don't have that, and at least now you'd know. So when you get home from the hospital, you can expect for the first couple of weeks that your energy can be low, your mobility, you'll be walking, but slowly. slowly at first. And most people do leave the hospital using a walking aid of some kind, using a crutch or two crutches or a walker. This sometimes using a walker for the first 2 or 3 days, or maybe just at night when you're tired and a little bit groggy. But they are progressing quite quickly, and there are a lot of people that no longer require these gait aids for short level distances as early as a week or two post-op. So you might be coming in to get your staples out and not needing, you walking still mindfully, but maybe not needing crutches or a walker at that point. When you first get home, take a bit of a convalescent approach. Give your body a few days to recover. It's major surgery, and all of your body's energy is going into healing. So that's where that energy fatigue feeling can come from. So use the energy you've got to move around, do little walks every hour. We would like you to be walking somewhere around in the house, between up and down the hall, or between the kitchen and the bedroom and the living room and things like that. Do your exercises spaced out throughout the day, 4 times a day, and then get some rest. Rest, elevate, ice, and let your body sort of do that rebuilding and recovery. Keep it safe, keep it simple. Try not to overschedule yourself or be too busy or get tricky or walk on icy pathways and things like that. Just kind of keep it simple for the first week or so. When you are sitting, standing, getting up, lying down, you can kind of move within the ranges that your body feels is okay. There is not a list of hip precautions or restrictions and rules, but the one common theme is do not force the hip movement. It is going to become flexible to bend and move more as the stiffness and swelling resolves. And as you do these exercises, the strength and support from the muscles will come around and support the hip that much better. So, you give yourself a little bit of time, get the swelling down, do your exercises, and that's going to be your best way to kind of gradually and gently get more motion in your hip. In the meantime, while it's a bit stiff, we do not want you forcing it or having any awkward or jarring type motions. Don't be tripping on the rugs. Roll those rugs up and just get them out of the way for a few weeks. Have a raised cushion on the, if you've got a really low sofa, use a cushion on the seat, or raise the furniture a little bit so that when you sit, it's gentle and you're not dropping down suddenly, thunking onto your new fresh hip, or wedging it into more of a bend than it's ready for. So you do need to sort of have some armrests, gently sit. When you stand, push through your legs, but also push through your arms, and just try to keep things a bit gentle. So this is where we talk about the equipment, and sort of managing the daily activities and keeping things gentle so that your healing can just get a good start. The equipment we'd like you to have set up at home, all ready to go before you come in for surgery, would be the crutches, which you'll bring with you with your name on them. A two-wheeled walker, perhaps, for home. It's a little bit hard to know who's going to need the walker and who isn't. So, there's some thinking that it's just easier to kind of have these things and then return them if you don't need them. The Red Cross can also loan raised toilet seats so that, again, your toilet's not lower than knee height and you're sort of dropping down at the end and thunking onto that hip. If you've got a raised toilet seat, just know that it's either elongated or round, depending on the shape of your toilet. So have a good look at your toilet before you go down to the Red Cross to pick something up. Armrests on the toilet are helpful if there's a bit of space for them. They attach to the toilet and they just sort of allow you to stand up nice and straight, pushing through both legs, because you can also support with your arms, and how to sit, allow you to sit a bit more gently. For a bathtub, most people are not really strong enough to step over a high step like that and put all of their weight on the operated leg, whether it's the first leg in or you're standing on it while you step in with the good leg. That's usually going to be a couple weeks down the road at least. And so having a bench like this one where you can sort of back up to it, sit down, and then just slide your bum back and spin around to bring your legs into the tub. That's probably a safer way to go about it at first. If you have a walk-in shower, many people are okay to step and stand in a walk-in shower within the first few days or a week. But if you would like to have the sort of the safety backup of a bit of a stool for the shower, those are available, shower chair or a shower stool, just to have something in there that you can raise set to kind of a perching height and just have it for a bit of extra balance. Other helpful equipment, but that is not available from the Red Cross, might be different types of grab bars, a handheld shower head, to kind of point the water where you need it without too much twisting around. Of course, a non-slip mat. Make sure you're not slipping or skidding in the shower. Long sponge if you want, you're not going to be necessarily able to reach down and bend your hip that much to wash your feet right away. So if you're going to want to, maybe get a long sponge. Same thing with a long shoehorn, a long sock aid. We call this guy in the middle. It's kind of a device that helps put your socks on, and there are patterns on the internet that you could make one yourself, or you can purchase these in a medical supply store. All of these items would need to be purchased from a medical supply store or pharmacy or something like that, or make them. Some of them you can make yourself. One thing that I think is really helpful for pretty much everybody is to have a long-handled reacher. That's going to be something you could sort of pinch the front waistband of your pants or underwear in that front claw and lower it down to the floor without bending your hips a whole bunch, and kind of wiggle your feet in and pull them part way up. I think if you're going to spend $20 on something, the reacher is the thing that you're probably going to be using for at least a few weeks, if not longer. A leg lifter is helpful for many people, again, in that first week or so when the leg can be quite heavy with swelling and those front hip muscles are feeling pretty stretched and sore. A leg lifter is kind of a hoister. It's some kind of a strap with a loop on the end. Some people put a loop in the end of a leather belt and just sort of catch their foot with that loop and help lift it up onto the bed so that you can be moving a bit more gently. But probably within a week or two, you wouldn't be needing that thing. Chairs with armrests, very useful for sitting gently, standing more easily. If you have a recliner, great. That can be a good place to spend some time during the day with a few extra pillows to bring your legs a little higher. But if your recliner is really low, you might want a cushion on the seat or a bit of a platform underneath or some 2x4s. In the car, to get in and out of a car, a few tips and tricks on this slide. This is something that's very individual to how tall the person is and how tall or short, low their car is. Usually a van or an SUV height vehicle is going to be the easiest for most people to just kind of back up, sit your bum down on the seat and sort of slide your way in. If your car is very low, has low seats, ask the driver to park away from the curb so that you're getting in from street level and not from up on the sidewalk. Get a cushion, some kind of a firm foam cushion that you can put on the seat that isn't going to sink down when you sit on it. Surplus Herbie's in Vernon has a foam shop that you can probably get a decent piece of foam for about $20 or so. Put it into a pillowcase or a garbage bag or something on the seat of the car. A plastic bag on the seat is another patient tip. They've said if you've got that plastic bag, a grocery bag, or any kind of plastic bag on the seat, that can be quite helpful just to help you kind of slide back and in. But also move the seat back, recline the seat back a little bit so that when you get in and you could lean your body back when you need to sort of pick your knees up to clear the door frame. You don't want to be wedging that hip uncomfortably. your first day of or after surgery. Just give yourself as much body room as you can to get in and out. The next time you get into the car, it's probably going to be a week or two down the road. You're going to be feeling much better. So it's just taking it nice and easy that first trip home from hospital. So getting the Red Cross equipment, Red Cross or various sort of community loan cupboards have a pretty good pool of equipment. We use them really heavily in BC. And the Red Cross itself, there is a bit of process around that where the forms need to be signed by a clinician, like a therapist, a physio, or an OT. And so you'll be asked sort of which of these items you need, and the forms will be faxed in from our end so that you can go to your local Red Cross and pick things up. This slide has got the hours and addresses and phone numbers for a few of the Red Crosses closest to us. I do like it, or I kind of ask people to phone ahead before you go down, make sure your paperwork is there, and let the volunteers at the depot know when you're coming to pick up the items so that they can put your paperwork into the computer and gather up the equipment, and it's sort of a quick in and out visit for you. If you're not from any of these communities, you can probably look up redcross.ca and find this BC Health Equipment Loan Program. Enter your city and they'll help you find the closest depot. So that's probably where your papers are going to be sent. So in summary, make sure you've got your rides arranged to go home from hospital, knowing that you could be discharged the same day, probably in the later half of the afternoon. Otherwise, it'll be the next morning, probably pretty early in the day between 9 and 10. So your ride should just kind of know to be by the phone for those times. Make sure you've got your support people there at home first couple of days, but even for first couple of weeks, it's nice to have some extra help with making meals and doing laundry and getting groceries and some of the big stuff. Your energy will be kind of low, and it's nice to give your body a bit of recovery time if possible. You'll need rides to get to your staple removal and your first few physio appointments. So the discussion about when you get back to driving, really this is something for you to make your best judgment on your own behalf about your own medical fitness, sort of legally and liability wise. How fit are you to drive? We do not really want you to take any risks with safety in the vehicle, but also think about if you needed to brace yourself or slam on the brakes. We don't want you jarring that hip. It is going to take a few months for the bone to kind of heal and grab onto those components pretty securely. So, you know, it's good if you can give about 6 weeks of having somebody else get you where you need to be. And get your equipment and any you know, other mobility aids that you're going to be using to have, if you have those picked up about a week before surgery. It's just nice to have those things in place and that part of your checklist done about a week before. If you have any questions, this email address is the one that we use for many of the equipment and those Red Cross loan form type questions, or this cell phone number. The cell phone is, the messages are checked Tuesday, Wednesday, Thursday, roughly, so sort of on a part-time basis. So you can leave a message there, or you can use that email address. Either would work. If you have questions that are more for the nurses about medications and things like that, probably it's better to phone this other phone number for the nurse. Thank you very much. I wish you all the best with speedy recovery and an excellent rehab and a long life with your new hip. Thank you.